just want to thank everybody for joining us this evening. I understand that we're taking time away from our families, but it is a wonderful opportunity to have PWSA USA and several members of our advocacy committee share our work with you. Over the past couple of years, we've had a lot of members in our community become involved in work that we're doing on both the state and the federal level. And we've had quite a few of you within the community ask why, right? Why is this work important? How will all of this stuff affect my family? How is it going to improve the life of my loved one with PWS? So our hope is that this evening's webinar will not only share the how portion of how our work will help, but that it will shed some light on why it's critical that, especially at this point in time, everyone in our community bands together to advocate for PWS. The individuals that you're about to hear from this evening represent nearly 4 decades of parenting individuals with PWS. So the perspective that each one of these parents brings to the table will not only help to define our work as advocates, but their stories have helped shape the policy that will affect people with PWS and other rare diseases for generations to come. So like I said a few minutes ago, we've gone ahead and activated the chat. I encourage all of you to interact. We've also activated the Q&A, so please feel free to ask questions. Once our presenters are done, we'll do our best to get to all of you. In addition to that, I did put my advocacy email in the chat for all of you who'd like to connect with us offline and get involved and maybe have a one-to-one and learn a little bit more about what it is that we're doing. So with that, I would like to go ahead and give the floor to our first speaker, which is Elaine Toll, and have her share some of her story, her history in the world of advocacy, and how the work we're doing is impacting her life and the life of her son, who is 37 years old, living with PWS. So Elaine, take it away.
Thanks, Dorothea. So as Dorothea said, my name's Elaine Toll, and I'm from New Hampshire. My son James is 37, and he's currently living in a supported apartment in Massachusetts. I'm excited to share with you all tonight. I clearly represent the older end of the age spectrum here. My son was born in 1986, which is way pre-Google. So just think about that for a minute. No Google. Information wasn't as readily available, but we did learn about a PWS expert in Connecticut right after my son was born, Dr. Suzanne Cassidy, whose name will be familiar to some of you. She served on the PWSA scientific board for many years, and we saw her annually for a number of years until she relocated. We also learned about the Blue Book, the first reference type book about Prader-Willi syndrome, and Stacy Ward probably knows the real name of it, but I can't remember. And that really became our Bible. That was our touchstone. It told us really what people knew about Prader-Willi syndrome at that point in time. So just imagine life without Google. It's hard today from this perspective to think about that. I've been a member of PWSA USA and my local chapter, which is the PWSA chapter of New England, for many years, but didn't start getting really actively involved until 5 or 6 years ago, as I started slowing down in my professional life, heading towards retirement. I joined a couple of PWSA USA committees, and I've enjoyed every minute of the work I do with them, especially the advocacy work. And I would encourage all of you to consider getting involved in advocacy at either the state or the national level, or both. I do it because I want to serve my son and help make the best life for him, and serve the larger PWS community. And advocating on issues important to PWS families helps all of us. Educating your legislators, as you'll hear as I go on, is the first step. And over time, you establish relationships with people that can make things happen for our loved ones. I joined a group of PWS advocates in Washington at the end of October, and met with both of my Senate offices and my congressman's office. It's incredibly satisfying to have the health aides from these offices start to remember you from previous visits, and that's kind of a goal. You want them to know who you are. And every time you go, every visit cements that relationship. Last week, I traveled to DC as a tourist, and I went to my congressman's office to get gallery passes for a tour of the Capitol building. The health aide came out of her office, and as I started to introduce myself, she stopped me and said, "Oh, you're back. How can we help?" And it was awesome. It was like, yes, okay, I'm making progress. This is great. But it's just repetition. You learn more every time you do it, and you just start enhancing those relationships. So that really is the response you're looking for. And this is happening for many of us advocating for PWS. People in Washington know who we are. They know why we're there. And this is the beginning of how things get done. So let me tell you a little bit about a bill I talked about with the legislators I met with in October. It's called the Protect Rare Act, and it was recently introduced in the House of Representatives as HR 6094. Actually, I think it was introduced the same day we finally had a Speaker of the House. It was one of those bills that got introduced that day. So it's HR 6094. This bill's about medical necessity. And that's a term many of us have heard, I'm sure. Medical necessity is all about the diagnosis that's attached to a drug when it's approved by the FDA. Frequently, when someone is prescribed a drug that's off-label or not on the labeled indication, it's denied by insurance. It's denied by Medicare and Medicaid. So it's really denied by all payers. HR 6094 will broaden the definition of medical necessity for rare diseases, including Prader-Willi syndrome, to add peer-reviewed literature and clinical guidelines as areas that must be considered when a patient with rare disease needs access to a drug. So here's a quick example. Many of you have heard of pitolisant, which is FDA approved for narcolepsy and cataplexy. And you know that many people with Prader-Willi syndrome, including my son, have excessive daytime sleepiness. If insurance companies can consider peer-reviewed literature to make coverage decisions, they'll find scientific articles about the use of pitolisant in the PWS community for excessive daytime sleepiness because of studies that have been done. And hopefully they'll approve the prescription when it's your loved one that needs it. Interestingly, there's a precedent for this in the oncology world. I spent over 40 years, my professional career in oncology, and I remember 20 or 25 years ago when the definition of medical necessity changed for cancer drugs. And I remember what a life-changing event it was for both patients and prescribers. I reminded my legislators about this precedent and assured them that there have been no negative consequences in oncology. Now, you don't have to be an expert to talk about these bills. I happen to have experience with medical necessity because of my professional career. But if you're going to go to the Hill or going to go to your state, there are lots of resources for you, and the PWSA advocacy team will help get you prepared with the information you need to make those visits with your folks. It's also great to get feedback after these advocacy meetings. It doesn't always happen, but sometimes it does. A couple of quick examples from the recent trip to Washington. I met with a senator's office from Maryland while I was in DC in October because our Maryland person wasn't there, and so we had an appointment, so I went ahead and did that. After the meeting, I sent a thank you note and gave him a little more information about the bills we had talked about. And he immediately sent a reply thanking me for the meeting and thanking me for the info. I'm not even his constituent. So it was great. It was a good sign that the meeting went well and he was thinking about the things we talked about. I also had a note from one of my senator's staff letting me know that Senator Shaheen had signed on as a co-sponsor to a bill we discussed while we were there. Our specific ask for her was that she consider co-sponsoring, and she did. It was great, very satisfying, really exciting that you can see how the wheels are turning from the work that you're doing. One more fun story, while we were in DC, some of the other PWS advocates shared an elevator with my congressman. He was listening to them talk and he asked a couple questions and then asked if anyone would be visiting him. Could somebody come see me? And so I had an invitation. We were there. It was great. HR 6094, the bill I just talked about, is just one example of the advocacy work we're doing. Advocacy will have a positive impact for all people with Prader-Willi syndrome, all ages, not just your infant or toddler or my 37-year-old son. And everyone is an advocate every day. You're an advocate with your schools, with your therapists, with your doctors. Consider expanding your advocacy to your legislators. And you're the experts. Each one of us are the experts in Prader-Willi syndrome. We know more than they do about our syndrome, and there's no one more important or better to do this work. So my friends who are also going to present are all rock stars. They'll share more with you now. Thanks for being here. Jen?
Thank you, Elaine. You're fabulous as always. Dorothea, do you want me just to go ahead or do you?
Go right ahead.
Okay.
I mean, I could do the drum roll and do the fabulous.
No,
you know,
I didn't.
But you know.
So hello, everyone. I am Jennifer Garcia, and I'm the proud mother of Rocco. Rocco is 19 and living with Prader-Willi syndrome. Over the 19 years, the disease has taken Rocco and my family on many twists and turns. And like many of you on the call tonight, we started with feeding tubes onto Medicaid, private insurance, PT, OT, speech, IEPs, behavior therapies, medications, specialists, lawyers, advocates, Social Security guardianship, and much more. All of those have left us wiser, and most have left us with some scars. As Rocco grew into his teenage years, I found myself with more time and the mental bandwidth to be able to do more for Rocco outside of the home. And as with most things, timing was everything. And during that period of time, PWSA USA launched a parent advocacy team. I was honored to be able to contribute almost 2 decades, which is crazy to even say out loud, 2 decades of experience with PWS for the better good of the entire community, regardless of age or ability level. I can't express how empowering and healing it has been to walk the halls of our capital and say my baby's name, to be heard in a different way. A way that with persistence and dedication will bring change to everyone affected by PWS. And please know that this was not my background. I learned by being mentored by Dorothea and adjusting as each meeting unfolded with the members that we met with. There comes a time where you will find space for more. And it may seem impossible to some listening right now, but trust me, I've been there and it will happen. And until it does, please know that we are there several times a year, making our voices heard for all the individuals and families affected with PWS. When the time does come that you feel you are ready for the next step in your journey of advocating for your loved one, I hope that you will reach out to this very welcoming group. We have a really good time when we go to DC. And join us in DC, either in person or virtual, to say your baby's name in the halls that matter the most for long-term change. Because the more people we have with us, the stronger we are. Currently, when we meet with members and their staff, we have been talking about the Promising Pathways Act. This bill is bipartisan, so your political affiliation is not discussed. And there are many members from both sides of the aisle behind this bill. The short explanation is that this bill can cut the time for rare disease drug that can be approved for the rare disease drug without sacrificing the gold standard of safety that the FDA is known for. This is huge and can help everyone with rare disease, especially our community, as right now we have 6 drugs going into phase 2 and phase 3 trials. For example, Rocco was able to participate in a phase 1 trial last year and had a very positive response. That was last year at this time. During the month he was on the drug trial medication, we enjoyed Thanksgiving, my middle son Michael's birthday, and Christmas, all with positive effects on this medication. It was nothing short of beautiful. Rocco was relaxed and able to enjoy the skills taught through therapy to regulate his behaviors and had control over his eating. We all enjoyed the holidays last year. Unfortunately, we have not had access to the medication since the trial ended. The company is now enrolling in phase 2, but my mind always goes back to time. Does Rocco have enough time? And do I? Does my husband? Do his brothers? So this bill really matters in our world because it brings up the topic we all think about and concern ourselves with the most: time. We have gained so much ground in the past 2 years. Our game is consistent persistence to have our voices heard. emails, phone calls, virtual meetings, and in-person meetings. When we walk into member offices now, just like Elaine said, they recognize us. And that not only is wonderful to feel, but it tells us that we are being heard and remembered. We have built solid contacts within the offices and continue to broaden our network. I am sure that the work we are doing will bring the much needed change to our community. And remember, you are all advocating for your loved one. Since they were brought into your world, you have been doing a great job of getting what they want and adjusting to the audience that is listening, whether it be specialists, therapists, IEP teams, bus drivers, restaurant employees, everyone. So this is DC, just another forum for you to tell your story to get what you need for your baby. The members in those offices do not know Prader-Willi. You do. So it's up to us to tell them so they can help us, because I have seen it and they do want to help, but they don't know what they don't know. So we need to tell them. So I hope you will consider coming with us, even if the first time you just listen and get comfortable, or if you do want to speak about a bill, we can help you find your voice. It only takes a few times and you will feel so empowered to do even more. Jen is going to talk more about the Promising Pathways Act, but if you have any questions, I'm happy to answer them. And with that, I will hand it over to Jen.
Oh, I did the classic unmute, mute thing. I just want to say there's always more than one Jen in the group, so I feel lucky to share with you, Jen Garcia. I don't know, I'm a notch further down in the age groups here, but my story is not unique to the PWS community. My daughter was born 6 years ago via an unscheduled C-section after a wonderful and uneventful pregnancy. She was transferred to another hospital's NICU on day 2 due to lack of eating and severely low muscle tone. I'm sure these things are not surprising to hear. She was transferred, and then we spent Christmas in the NICU, and one of the neonatologists poorly delivered the diagnosis of Prader-Willi syndrome the day after Christmas. We came home with a G-tube when Josephine was about 2 weeks old. We were luckily contacted by Christy Rickenbach and Diane Seeley and set up with a parent mentor. And as we processed and grieved and got to know the little girl we'd fallen so deeply in love with, we also did the things that we all do as PWS parents over time in those early years. We got growth hormone, we figured out the diet, we advocated our way through the IEP process, the beginning of the IEP process, and spent hours on the phone with specialty pharmacies and in the PT, OT, and speech rooms and waiting rooms. And my family was very lucky to build an amazing support system along the way. I know that's not true for everyone, but that is something that happened for us. And because of all of that and the way that PWSA supported my family and the friendships I developed out of that, there came a time when I was ready to do more and to give back. And that time is different for everyone. I want to say that. For some, it is when their child is much older, like Elaine. For others, like Andrew, who's coming up next, and maybe when your child is younger than even Josephine was. But I started volunteering for PWSA and eventually in 2019, I think, found my way to the advocacy work group. I felt completely out of my element. I like to write. I had written an odd letter here and there and had signed petitions and whatnot, but I had never really advocated for legislation and policy change, and those things sounded pretty daunting to me. But what happened was that I started reading and I listened and I started thinking about the generations of PWS kids and families that had come before us, like before there was a diagnosis, or since there was a diagnosis and there was no growth hormone. Since there was growth hormone and they've been through the roller coaster of maybe there's a drug, no, there's not. Maybe there's a drug, no, there's not. Getting shut down by federal agencies and fighting for services tooth and nail. And when I thought about what they had been through and hoped for and worked for, I just felt that it was time for me to put in that work too and move the needle. I participated in the DC fly-in last fall, and whew, my goodness, the nerves. I think I was shaking in my first meeting, even though I was with 4 other people sharing their stories. But after each meeting that day, the nerves subsided just a little bit more. And by the end of the day, as exhausted as I wished we had one more day to do just a little bit more. I was so hooked. Other than being a new parent mentor, which I also cherish, I couldn't think of a better way to give back. Really give back to this community that has held me up through some pretty trying times. So here I am, working with state and national governments and institutions and agencies to support people and families living with Prader-Willi syndrome and other rare diseases. My goal is just to bring awareness to PWS and rare disease and make sure that the pharmaceutical companies that take a chance on us have the support they need, and that the FDA really knows who we are and what we need, and that the legislators remember that we are their constituents too. If you don't speak up, do they know you're there? I will confess that when I started with the group, I didn't even know what policies or legislation was affecting us. I really didn't. I came in clean, a fresh set of eyes and a clean slate, and kind of naive. And I've learned so much in a short amount of time. I still have a ton left to learn, but I wanted to say that because I don't want your lack of knowledge or your perceived lack of knowledge to keep you from this work. Like Elaine and Jen have said, we are the experts in PWS. We are when we go into doctor's offices, we are when we talk to specialists and PTs and OTs and teachers and everybody. We live this right alongside our kids. And so we have much to share and a great perspective on what affects us and what we need. When we were in DC, I mean, I was honestly surprised that we were granted meetings and that someone in these offices, sometimes the senator or representative themselves, would take the time to listen to us. I have to tell you, it feels really good to be heard. Like Jen said and Elaine said, sometimes it's surprising. Oh, you know who I am, or oh, you remembered. It's very different than I thought it was going to be, and it's much better. And it feels so good to say, this is what matters to me, and this is why. And of course, like, that's so much easier to do when what it is your child and their friends and your friends' children. So I want to give not just a voice to our community, but a better life to everyone living with or caring for PWS. And I'm talking about adults with PWS in group homes, parents of PWS individuals who've had to quit their jobs or are bankrupting themselves trying to provide for their child, siblings whose own lives are forever changed by PWS, families of young adults and young children with PWS who cannot travel to DC to do this work. I feel very strongly when I go there that I'm not there for myself. I am there for us. And by us, I mean all of us. Yeah. So Josephine is 6, like I said. She's going to be 7 next month. And in the beginning, getting to that age number seemed so far away, so utterly daunting. And I had no idea how we were going to get where we are now as a family. I certainly did not think that we were going to have as much joy in our lives as we do now. We are still, generally speaking, in that honeymoon phase. Josephine is highly interested in food, but she's not entered hyperphagia. She has a hard time with some emotional regulation and behaviors, but she responds pretty well when provided certain supports. So we enjoy her and we enjoy our time as much as we can. As we all know, future years of PWS bring uncertainty in the worst ways. There are many dark clouds, and I haven't told Josephine about those yet. She knows that she has PWS and that it means that she has a special tummy that can play tricks on her brain, that she has low muscle tone, or as we say, sleepy muscles. She has excessive daytime sleepiness. She knows that, and she knows that she struggles with fine motor tasks. We make sure that she also knows that she has superpowers with kindness, empathy, inclusion, a strong sense of justice, curiosity, and a great memory. But there are things that she does not know: the potential for severe mental health issues, the extent to which hyperphagia could ravage her mind and body, that she won't be able to get pregnant and have those babies she's dreaming about, or live alone. So this is why I do the work, because when the time comes, I don't want to tell her about the dark clouds in PWS without telling her that I've done everything I can to make her life and the life of her friends and all the people in the PWS community better. I really want to tell her that while it could be scary to have this thing called PWS, that there is help. And I think of those generations of PWS families that haven't been able to say that haven't been able to give that hope. We are living, I think, in the most hopeful time in history of PWS. We have 6 medications in phase 2 and 3 clinical trial that look amazing. We have a relationship with our national offices. We have this robust advocacy organization that gets things done. And I think this is a really hopeful time. And I want to be part of that hope. I want to be part of this history. And I hope you do too. This is not fast work. This is not, oh, I went to DC a couple times. This is a marathon, not a sprint. We've all heard that, right? In the early days of this. And that is certainly true with advocacy work. We're developing relationships now that are going to pay off for the community for years and years to come. And that's why we need everybody we can get to come with us and be with us on this journey of letting our government officials know that we need help. And so the 2 ways that we've done that most recently have been with what we were doing in DC this last time. And that was, as Jen mentioned, the Promising Pathways Act. The numbers on that, I think, are 1906 in the Senate and 4408 in the House. And that act is really interesting to me. I think it's really innovative because it cuts down that time that it takes to get a drug into our hands, into the hands of people with life-threatening diseases. This is not necessarily, this is not definitely PWS focused. This is for all kinds of diseases, with that term life-threatening being the key. Right now, the fastest track in the FDA, fast tracking something through the FDA takes 6 years, right, Dorothea?
On a good year, yes.
Yeah, optimally, which we all know how optimal things work out. But that is too long. There are people with diseases that have a shorter lifespan than that. And we need this to speed up that process. So what it will do is give provisional license to medications that have positive clinical trial results early on. So you're not, and great safety results. So you're not compromising safety, but you're letting these populations like ours that might be able to be willing to take on a little more risk, do that. And it gives a provisional license for 2 years up to 4 times while they kind of finish up with the FDA and get full approval. And then once approved, the FDA has to bring that drug to market within 60 days of that approval. So we're talking about the fastest track ever for the FDA for medications for people that really need them and maybe have never had them. Most rare diseases have no treatment. We are one of the lucky ones that have at least growth hormone, but as we all know, that doesn't address the main thing that we need addressed, which is hyperphagia and those behaviors. So that's the PPA in a nutshell. And the other thing that we talked about, Andrew will kind of go into that. I think I've gone way over my time limit, have I? Yes. Okay.
Okay.
So I'll let Andrew talk about.
Sorry. It's okay, Jennifer. You did a really good job. So on that. Hey guys, this is Joseph. He's 2 years old, and Kristen, and I'm Andrew. We live in Gulfport, Mississippi, and we got involved with Advocacy. We went to the first trip in the DC fly-in, which a little over a year ago. Went up there. It was great. We got to meet a lot of people. Got to meet some other PWS kids as well, and get pictures taken with Joseph and stuff. So it was great on that. So we joined the Advocacy because, you know, the path that has been burned by a lot of the older kids, older than us, have made it much easier for us from the day we got our diagnosis to where we are today. And I know it hasn't always been that easy, but it's always been the path that the PWS population has burned for children like Joseph, who are only 2 years old. And, you know, we're succeeding where we can. I'm not going to lie, the delays, that's what we're dealing with today. And they're tough, you know, especially when you have a neighbor that has a child 1 month younger than your child and running circles around him. But I know we will get there and things of that nature. So we got involved. We went a little over a year ago. We reached out to any connections we had locally, just told people we were going to DC. If you could make a phone call or let them know we were coming up there, we would appreciate that. That went a long way. That seemed to help a whole lot. So we at least had a phone call before we were coming in and doing that. This past time we went to DC, we've actually got some people locally who want to help. But getting to DC can be very tough and can be very expensive. I know it was very expensive for me to go up there this last time. And thing. But I was able to bring my laptop into the meetings. We were able to Zoom people in, and it made a really big difference. And we were able to, for the staff member that we met with, they were able to hear more stories. Because, you know, we have a powerful and very moving story to tell. This disease has disastrous effects and is, you know, it's very painful for our children when they get the hyperphagia and things of that. So people listen and people understand to what we're saying. But once meeting with these representatives and things, I feel as our message and what we're asking for is actually going higher than the staff level for the health. It's actually getting to the members of Congress. And that's the important part. You know, if we can get to the members of Congress, those guys talk amongst themselves. And then they start building teams that can help us with this stuff. But the only way we can do that is we need more Senate offices and we need more House of Representative offices. We need to literally, I would love to be able to get 100% of all those offices. And I know we can do it. And it's not very tough to do. It's getting to DC can be tough, but I've found that we can virtually do these meetings. We can set up meetings next week and start talking to health people. That portion of it can happen very, very fast if we wanted to. And like I told Dorothea, all of us here are more than welcome to help in any way we can. If you need us to help you set up a meeting or make that first phone call to the office to set up that meeting, we will join the meeting, we will help you, and you will find that this is not a hard ask and that these people actually want to help us get the things we want approved and get our process moving through the system, because they get the bureaucracy of it. They get how slow things are. And when you have a disease that has a time frame on it, there's just not enough time to go through the normal bureaucracy process. So we are more than happy to help do that. We've had a lot of good luck, believe it or not, with the connections we have started making. I mean, we're getting phone calls from local point men for the senators on the coast, taking us to coffee and offering the full help of their Senate offices and things. I just never thought that would happen. I always thought you go up there, you tell your stuff, you walk out, they take your stuff, throw it in the trash can and move on. Well, that's not how it works. They're actually listening and they're wanting to help us because they get our plight, and it's very easy story to tell. So please consider joining and helping us. We will help you set up your own teams and your own meetings But, everybody has 2 senators and a congressman that represents them in DC. And there's no reason we shouldn't at least be knocking on their doors, because we can really start to move the needle for Prader-Willi in a really fast way with the help of Congress.
Thank you so much, Andrew. And thank all of you for the time tonight and sharing a little bit of your stories. We do have a few questions in the chat. But before I get to the questions, I want to throw some numbers out. We've talked about a lot of different things this evening so far. We've talked about a couple specific pieces of legislation. We've talked about what it's like to advocate. We've been addressing different age groups with PWS. We've talked about this being a marathon and not a sprint. I want to throw some numbers at all of you who have joined us tonight, so that you can try to put this into perspective. We're talking about Prader-Willi syndrome. And those of you who know me know that I have a 6-year-old son with Prader-Willi syndrome. So I speak to this as a mother, a caregiver, and an advocate. But when we talk about Prader-Willi syndrome, and we're talking about this in relation to where it is with rare disease, we're talking about 1 out of every 10 people who has a rare disease. So we know that this is not a matter of if, it's a matter of when. And it might not be Prader-Willi, but it will be something else. That's over 30 million Americans who are suffering from a rare disease. But when you're looking at 30 million Americans with a rare disease, you're looking at least 90 million Americans who are affected by that person who has that rare disease. And when you have 330 million Americans in this country, that's 25% of this country's population who are suffering from a rare disease. So when we talk to you about taking Prader-Willi syndrome and making it larger, it's not that hard. It is one of many rare diseases, but 25% of the US population is a really large number. It's also a really large voting bloc. And helping people who are affected by rare disease, it's not a red issue, it's not a blue issue, it's not a partisan issue. This is a human rights issue. And these members want to help. And the members that we've had the opportunity to work with in DC genuinely want to help. We have members that are helping us, excuse me, work on trying to get PWS recognized with Social Security and have it put on the list of compassionate allowances. And I know that there are some folks that are joining us this evening who have worked really hard on that over the years. That's one of the things that we're doing. So we're working on things that affect the entire population of PWS. We have an entire population of people living with PWS who had access to growth hormone as babies. They're between the ages of 18 and 23 years old right now. And growth hormone was only approved to treat people under the age of 18 with Prader-Willi syndrome. So how does that change? We have to go back to the drug companies and say, hey guys, you have to approve this for another indication. You have to approve this for the over the 18 and over population. That is advocacy. That is the kind of advocacy work that we're talking about here this evening. So with that, I do know that we have a few folks that are with PWS who are joining us this evening. And I want to say thank you. In the questions, it's actually come up, how do I do more? How do I get involved? I would say share your story. You start by sharing your story. If you have the ability to come to DC with us, and whether that's through our next DC fly-in, which is going to be May of this year. Everybody, I believe, has seen the save the date, I hope. And that's May of 2024, whether it's through our DC fly-in or whether it's through another opportunity. Maybe it's through Rare Disease Week with the Every Life Foundation. Maybe it's just on a whim where we're able to have some folks go to DC and have some Hill meetings like what happened in October. That was not scheduled. That happened within 3 weeks, but it was an amazing experience to have. So I would say, share your story. We've had some other folks ask about how you're able to participate in terms of, taking time off work, a financial investment. These are some of the things that we're working on as an organization. And, we had our first advocacy fundraiser last year, and it was called Walk a Mile. We'll be doing it again in 2024, but we were able to raise money last year through this Walk a Mile campaign so that in the year 2024, we will be able to start at least helping advocates who are able to take some of these trips. If you're able to go to DC for maybe it's Rare Disease Week, maybe it's just Rare Disease Day, maybe there's an opportunity for you to testify at a congressional hearing. These are the types of things that we want to be able to help the community with. And so when you see the Walk a Mile campaign coming in January, because you're going to see it, that's what we're doing, so that we can help to try and subsidize some of the costs of going back and forth to DC for our advocates that are doing this work. It does take a lot out of you. It is very hard. And I speak to that from experience because I often have to go with my son in tow. We don't have anybody who can take care of him. So as a mother of a child with PWS, my kid knows the halls of Congress better than most of those people in Congress. I can tell you that. And I think the Jens and Elaine and Andrew can at least testify to that at this point because they've seen it. I'm going through this. So yes, I think I answered that. Do people who are advocating with us or in a group, do they have parents or family members, or do Congress understands that advocates? Absolutely. Okay. Thank you, Sarah. Advocates can be caregivers. They can be caregivers who aren't parents. They can be grandparents. They can be aunts, uncles, cousins. They can be siblings. We have an entire generation of people with PWS that are now being cared for by their siblings. Anybody who is affected by PWS can be an advocate. Anybody who isn't affected by PWS but believes that we need to do more for our community with PWS can be an advocate. Anybody can be an advocate. So yes, members of Congress understand the difference. And like Andrew pointed out, having the opportunity to do these virtual meetings is something that nobody thought of 5 years ago, right? That is a post-COVID plus, right? One of the few pluses that came out of COVID for our community. It is very typical right now to have virtual meetings. It is unique to be able to be in DC. And what Andrew was able to do on this last trip was something that I actually had never even thought of. And he said, hey, listen, what if we have people that want to meet with these members that can't make this trip? Can we do it virtually? And I thought, oh, I guess so. Why not? You're going to be there in person. You're going to bring their constituent up online and have the meeting, and you will be there representing in body, and the constituent will be there representing virtually. And it works. And the members listened and their staff listened. So if you can't make the trip, we can absolutely do it virtually. And that doesn't have to be through a big DC flying event. It could be picking up the phone and saying, hey, listen, I'm going to be in DC for a couple of meetings. Would you mind if I made an appointment with your member? And I'll give you an example. I received an email from Senator Braun's office the other day. They're trying to reach members in several districts regarding the Promising Pathways Act. I will put in the chat the members and the contact information for the folks that they are trying to reach. And if you are in any single one of these areas, hold on for me 1 second. I'm multitasking on Zoom. It's never a good thing. I don't know if all this is going to work. It's not pasting. Shoot. Okay. It's not pasting into the chat. So I'm not exactly sure how to do it. But you know what I can do is I can send out an email to everybody who's attended and everybody who's registered for this after the fact, so that you all can take a look at this list of members that need to be contacted about Promising Pathways. And if this is a member in your district, send an email, or if you're not even comfortable doing that, reach out to me. We'll help you do it. We can make an introduction. But it's easy. We're looking for folks in Vermont, Arizona, Rhode Island, Pennsylvania, Connecticut, New Hampshire, Washington, and several other states. So I will send this list out to everybody who's registered. It may not be this evening, but it will definitely be at some point tomorrow. I see. How do you sign up for the fly-in in May? Okay, so the registration for our next DC fly-in we should be opening up registration in January of next year, so keep on the lookout for that. We do have a preliminary agenda. If you check your email boxes next Friday, you will continue to receive more information on the fly-in, but look for registration to open up in January. So we're really excited about that. I'm still going through the chat. Connor, okay. Yes, Connor, thank you. All right, perfect. Okay. Does anyone else have any questions? I'm not used to this in a webinar format. I'm used to this in a meeting where it's a free-for-all and everybody just starts talking and asking questions. So if anybody else has anything that they would like to ask about getting involved or ways that they can help, I would love to answer your question.
Can I just chime in for a second? I've found it inspiring to see you, Dorothea, and Christy bring your kids when we're in Washington. And of course, Christy's daughter's older, but I think that's great. And I am determined to convince my son to come with me in May. So I'm looking forward to that. I think he can be a really great self-advocate, and I think he has a story to tell. So I would encourage that as well, folks, as you think about these things. If you have kids that you think could be involved, would love to do that. Love to have that.
Absolutely. And and it's that, thank you, Elaine, because that's a question I get all the time. Can I bring my kid? And your kid might be a baby, but your kid might be an adult. Yes, the short answer is yes. And I would encourage you to do so. For me, it's interesting because, my son doesn't have speech, right? He doesn't use words, right? But that doesn't mean that he doesn't have a voice. And I want him to be able to share that voice, even though he doesn't have the words to express himself. And I think that's the case for a lot of us in our community. And it is very different for a member or a staff member to have the opportunity to meet somebody who is actually dealing with PWS, as a patient, as the person with PWS. It's not something that they often have an opportunity to see. So if you have the ability to go in person, I absolutely encourage you to take your loved one with PWS. It definitely makes a difference. I could share some stories offline. I see that. Thank you, Stacy. There's a question in the Q&A. How do we get a list of events or requests? Stacy is answering that in our Q&A section, but all of that information, guys, if you get the Pulse newsletter in your email box, please don't delete it. Open it. There's so much useful information in there, I promise it. Sometimes it's overload because there's so much going on and we're doing so many things, but most of the things that we're talking about, you're going to find in your Pulse newsletter. And if you're not getting it and you want to get it, please send an email to advocacy@pwsausa.org so we can make sure that gets sorted out and you do get your newsletter. In addition to that, our website, the blog on our website, we have information on everything that we're doing is all over our website. So please take the opportunity any chance you get and look that up. And if you have a question, that's what we're here for. So please don't be shy. Oh gosh, I'm going through this chat. You guys are making me blush.
Hey, Dorothea, I believe there's some low-hanging fruit on the website too, right? Isn't there a way to send a form letter, a pre-populated
Yes.
form letter about active legislation?
What I was trying to do in the chat was actually put wasn't going through the link so that those of you who have an opportunity can send a letter regarding PPA to your member. Let me see if I can get this to go through.
Dorothy, I thought somebody had put it in the chat already, I think.
Okay, good. So we do have opportunities on our website. If you go to the advocacy page, if there is a campaign where there's something that your voice can be heard, most of that is on our advocacy page. But in addition to that, I think I just put this in the chat here. If you click on the link that says p2a.co, Thank you so much, Sarah. I appreciate that. That is a letter for the Promising Pathway Act. And all you have to do is put in your information. Guys, it's a pre-written letter, but it doesn't need to be. You have the ability to completely customize it and make it your own. Just don't be offensive, please. But it will go directly to your congressman and your US senators. So please take advantage of that. That's great. That's great, Donna. Thank you. It's exciting, right? Some of you may have noticed that we seem to be going to DC a little bit more lately. And the reason is because people understand, they're starting to hear about us. They're starting to actually listen to what's going on in the PWS community. So, you know, as an advocacy organization, we have been asked to participate in more events and more speaking engagements and represent the PWS community through advocacy at these events. So that too is very exciting. We'll be going back up to DC twice before the holidays. The first and second week of December, we will be there. So again, speaking to PWS, speaking to our story and how it relates to the rare disease community. And, you know, with some of these opportunities, we're now in a field where we're the only rare disease organization that's being represented amongst a host of larger rare disease organizations who represent multiple rare diseases. So these are really exciting opportunities for us to have our voices heard. I encourage all of you who have a story to share, to reach out to us. And we'll help you figure out how to share your voice. With that, I do want to be cognizant of time. I do see another question in the Q&A. Yes. Okay. So there's a question here. So would the best thing for us to do is to talk and meet with our representatives now? Absolutely. They passed a budget. They have a speaker. I mean, now is the time. They can do stuff. Absolutely. Like our presenters said here this evening, we have 6 drugs in the pipeline, but we have more than that. But when we say we have 6 drugs in the pipeline, these are 6 drugs that are phase 2, phase 3. Whereas, you know, in a little under 2 years ago, that was a very different story for us. And it was a very scary time after a lot of hope. We're in a good position right now. We are staying active and we are pressing members of Congress because although we are extremely hopeful and the data that's being collected on all of these therapies to treat PWS is solid, you know, we are within a division at the FDA that's never approved a drug to treat a rare disease. They have the ability to do so. They just haven't had the opportunity. Now we have solid data and we have done everything that we can as a patient community to continue to have our voice heard. We've done our patient listening sessions. We've done our PFDD. We're writing our Voice of the Patient report. We're staying engaged with the FDA. And by engaging with members of Congress, it helps the FDA understand that we're not going away. And we know that they have a job that is extremely important. But we have a rare disease that is extremely important to us, and we're not going anywhere. And we are going to make sure that our voices are heard, and that these therapies that are proven safe and effective have a chance at getting approved at the FDA. So that's yet another reason why the work that we're doing is so unbelievably important. So thank you. Sorry, I'm trying to read through the chat at the same time. Presenters have local offices. Yes, they do. Your representatives do have local offices as well. And what's interesting about that is that it's almost break time, right? And since they, you know, extended the budget and we now have a Speaker of the House, it looks like members will actually be going on break. And when they go on break, they do stuff in the district. They have office hours in the district. They take meetings with constituents. We are the kind of constituents that they want to meet with, especially in an election year. So take advantage of that. If you have an opportunity to meet with your member or even their staff in their district office, take advantage of that. The FDA person at the congressional hearing. Yes, yes, there's always one, Donna. Um, the FDA is looking at different ways to, accelerate the pathway approval process for orphan drugs. And for those of you who may not know, and I say this because I get to the point now where we start interchanging words all the time and you just assume everybody knows everything. Prader-Willi syndrome is a rare disease, and a rare disease drug is considered an orphan drug. So when you hear somebody talking about an orphan drug or orphan drug designation, they're talking about a drug that is being developed to treat a rare disease. And most orphan drugs go through the accelerated approval process, which at its best will take 6 years, and at its worst can take 15, which none of us really have 15 years. The FDA is, they're doing a lot, right? They are trying to speed up the pathways to get drugs approved faster. We have to remember that they are also a governmental organization, and there's a process that they have to go through in order to be able to do things too, which is why being able to look to legislation like Promising Pathways is beneficial to our community and to other rare disease communities, because while it takes the FDA 2 to 3 years, 5 years maybe, to develop a new pathway, as great as that might be, our families don't have that time. So being able to help members of Congress who are looking to make these pathways more accessible to rare disease communities like ours are extremely advantageous. So yes. There is a really long thing here in the chat, so give me 1 second. I have to read this. Okay. Okay. Marianne, I think we need to talk offline. Shoot me an email. Shoot me an email. But yes, building a relationship will be very rewarding. Yeah. Does PWSA work alongside FPWR to combine efforts? April, thank you so much for asking that question. Yes, the short answer is yes. Folks, we are a PWS community, right? Yes, there are multiple PWS advocacy organizations, but unless we work together as a community, we can't be effective. So it's essential that we be able to work together to advance advocacy efforts for PWS, period. End of story. Do we have the link to the special committee meeting? Very informative and helped explain how the process. I'm not sure which committee meeting you're talking about.
I believe
Okay.
she's referring, yeah.
Yes, to the Promising Pathway. Oh, yes, actually. And yes, it's in the newsletter. It's in the blog. I will also find it and see if I can get it in the chat. If there's anybody that's working the chat right now that can find that faster than me, that might be super helpful. But it's on the Senate Committee on Aging. You go to the Senate Committee on Aging website, and it's the Promising Pathway Act. It is all right there. And it was amazing to be able to have PWS specifically represented at this hearing, and being able to have a member of our pharmaceutical family speaking on behalf of their experience and work building a therapy for PWS was pretty spectacular. It was an incredible opportunity. So if you guys haven't seen it, I encourage you to. And it's not in the chat yet, so I'm trying to find it right now. While I'm trying to find this so that I can put it in the chat, are there any other questions? Okay. If Jen, can you take that?
Oh yes, I can. When we walk into our local representative's office, are we asking them to back the PPA? Is that the ask? Yes, that is the ask. We're asking them for their support. And you would either mention, if you're in with a representative, you would mention 4408. They'll want the bill number. If you're in with a senator's office, you'll mention 1906. And I think one of the things that I didn't mention that's really exciting about PPA is that it has gained a lot of traction in the Senate, especially. I think there were 4 sponsors signed on when we went to DC, and now it's up to 16. So that's some pretty great progress. And there's 6 up from 4, I believe, on the House side. So more House support would be great. I think we're in such a holding pattern for a while there. But yes, that's what you would ask for. And
Yes.
your story is connecting how, what your experience is and this bill. So why would this bill matter to you? And that's what we can help you with if you need help in like figuring out what that story is and how to say it more succinctly than I shared mine today. But
Great.
All right. Thank you so much, Jen. Folks, does anyone else have any other questions, anything they'd like to ask? Do we need to put anything else in the chat? Are there any emails that anybody needs to see? Looks like that's a no, unless somebody's
Dorothea,
typing
can
and
we
I can't
put
see it.
our emails in the chat if somebody wants to reach out
Absolutely.
to someone who's been to
Yes.
DC and
Yeah.
or has done some advocacy work, just if they want to talk to
Absolutely.
a regular person?
Dorothea, there's a new question.
I see that. Thank you for the, when we walk into our local, no, okay, that's the
That one
PPA.
answered.
That one was answered, yeah.
Is there a template somewhere to prepare to meet a rep?
Is there a template somewhere to prepare?
To meet a representative, to go into a meeting?
Well, sort of. You know what? I did put something together that I can send out to everybody. I can get it out tomorrow. I can do it, send out the template, which is, I mean, it's pretty basic, but it's a really good way to start. And I think it helped a few of us who were in DC the last time get some meeting requests in. So I can go ahead and send that out to everybody who registered for this evening's webinar. I will do that tomorrow. And yes, it's pretty easy. And if you do get to a point where you can't get in touch with anybody in your member's office, let us know, because we have folks that we can reach out to that can help us get you to the right person. These members have a host of aides, healthcare aides, legislative director. I mean, everything you could possibly imagine. So sometimes it's just about getting to the right person who's in charge of doing the schedule, and sometimes that's the actual scheduling aid, and sometimes it's not. So if you do have a problem, just let us know. Shoot me an email again, advocacy@pwsa.org. Yes, so we will absolutely be sending out the template. I will do that tomorrow. So sorry, I just saw that in Q&A too.
There's also an app. I think it's out of Minnesota, not to brag, but it's called Telling Your Story. And it's an app that like leads you through the process of crafting your story around your ask.
Okay. And folks, what we did with the last DC fly-in, and I anticipate that we'll be doing the same thing leading up to ours this coming May of 2024. We did a host of informational webinars for the community to kind of help people prepare, to help educate people. All of these webinars, by the way, are available on our website. But we did an entire webinar about how to share your story, and we brought in somebody who has been helping people craft their stories and put together elevator pitches for years and years and years. I anticipate that we're going to be doing a lot of that again, leading up to our fly-in in May. So keep a lookout for that. I will also be doing, office hours, like one-to-one office hours, a couple times a week, probably about 8 weeks before. So look out for that too. Any individual help we can give. One thing that you should be mindful of is that this DC fly-in will be limited. The maximum capacity that we are able to take to DC will be 100 people. So I anticipate that we'll reach that pretty quickly. So if it's something that you're interested in, when the application does go out, get it in first. Be fast about it. I think the spots are going to fill up pretty quickly this go. So, but thank you so much. Okay,
One more chat.
I see it. Yes, bringing a picture of your child that you can leave at the office. A lot of folks do that. It is helpful. It makes it personal. You know, we can't always bring our loved one with PWS, but you know, absolutely. If you can bring a picture, write a little note, or if you can't bring it or you can't meet in person, you know, send it with your thank you. Don't send it in a digital file on your email, because chances are that email will never get read. Our federal government has this great kickback system where if there is a file that's attached to an email, it often doesn't get delivered. So just keep that in mind. If you're gonna do a picture, send it in the actual mail. Don't put it in an email, because they'll never get it, and you'll wonder why nobody ever responded to you. But that's why. I want to thank everybody for taking the time to join us this evening. You know, it's always amazing when we have so much involvement from our community, and I want to thank our amazing advocates who took the time to prepare and to present with you all tonight. People hear from me all the time. I'm tired of talking. These guys are the real champions that are going out there day in and day out and making a difference. And I'm really glad that you guys had an opportunity to hear from them. And if you're interested in joining the advocacy work group, shoot me an email, advocacy@pwsausa.org. And that's great. You guys have a great night.